Now may I invite the next speaker, our own Purva madam.
Good evening, everyone. I'm grateful and delighted to speak in front of you all. It is a great initiative by Mighty Hospital and Suman Kidney Foundation to celebrate World Kidney Day by promoting fitness for all. Today, I shall be discussing the physiological interventions of diet and exercise to protect kidneys. I don't think such an elite crowd needs to understand or needs to be told about the importance of exercise, but nonetheless, I shall just focus on what exercise does for our kidneys. So, since nutrition will be taken care of in the next slide, next speaker's talk, I shall just focus on diet on one slide. So, many guidelines recommend high diets that are high in fruits and vegetables and low in animal protein because they are associated with lower endogenous acid load. This in turn will reduce the workload of an individual nephron, which will in turn protect our kidneys. So this is applicable for all individuals who are not having kidney disease or who are having kidney disease, both. Moving on, we all know that exercise has a positive impact on several organ systems like heart, lungs, brain, liver, musculoskeletal system. And many guidelines recommend that exercise for more than 150 minutes, but less than 2000 minutes per week, that is aerobic as well as strength training, can have longer effects of exercise as all these systems. Basically, there is reduction in sarcopenia, there is increased glucose uptake, muscle endurance is also increased. The VO2 max, as explained by Dr. Patni sir, increases with exercise. There is decreased inflammation, depression. The cardiovascular capacities also increase with chronic physical activity. And of course, there is reduction in insulin secretion and increase in glucagon secretion. So what about kidneys? Well, kidneys play a very silent role when we are exercising, basically because they do not take up the increased demand of oxygen supply, or they do not even occupy any extra energy while a person is exercising. So what happens to the kidneys as physiologically when an individual is exercising? There is a relative decrease in renal blood flow. Around 25% renal blood flow is reduced while exercising because the blood is diverted to musculoskeletal system, which requires energy production. Then there is effective reduction in renal plasma flow, but the reduction is not as much, so the effective glomerular filtration rate remains to be stable and it is not altered. The other physiological effect that exercise has on the kidneys is there is transient mixed proteinuria. So in case there's somebody who has exercised, any form of exercise, maybe mild or strenuous, they can have transient proteinuria, which lasts for about 1 to 1.5 hours post-exercise. So we should avoid sampling during this period. Lastly, the effect of exercise on kidneys is kidneys basically have an acid-base balance and fluid balance function while exercising. So what happens is on the left hand, where the screen is yellow, what we can see is there is increase in intensity of exercise from rest to 25% to 50%, 75% and 100%. So what we can see is that there is a decline in pH physiologically from 7.42 to 7. So to compensate for this metabolic acidosis, the kidneys take in and have to produce bicarb. That is, the spent bicarb is around 80 with 100% of intensity of exercise. So they have to produce 6 ions of bicarb to balance and bring back the transient metabolic acidosis to normal pH levels. Another thing that the kidneys have to do while exercising is that, as we can see, during rest, we produce around 1400 ml of urine. But when an individual is exercising, it has an antidiuretic effect. So around 500 ml of urine will only be produced. Other thing is that it is important that while exercising, other fluid losses are conserved through lungs, stools, and sweating. So we can see maximum amount of fluids is lost during sweating, that is around 4 liters. So it is very important to stay hydrated while exercising. Now, coming to patients who have kidney disease, what happens to them, and is exercise advisable for patients with kidney disease? So the issue with kidney disease patients is they have a reduced exercise intolerance. Exercise intolerance is basically reduced performance of the heart in order to balance or the requirements of any strenuous activity. So for instance, if a CKD patient is asked to do 5 squats or is asked to walk 10 meters, they'll get breathless. So that is called exercise intolerance. Now, exercise intolerance in kidney disease patients is directly correlated with the kidney function. Now, because of kidney disease, there will be uremia, there will be metabolic acidosis. This in turn will cause sarcopenia, there will be fluid retention, respiratory muscle wasting. There is increased sympathetic activity, increased renal nerve afferent activity. And because of that, there will be increased left ventricular hypertrophy, and myocardial stunting will also be there. Along with that, systolic and diastolic dysfunction can be seen. So how do we overcome that? Basically, kidney disease patients should not be told that you cannot exercise. In fact, the motto of every physician or every nephrologist should be that we should increase the quality of life of the patient. So in order to do that, exercise is the best and cheapest prescription that one can give for their patients. Now, what are the issues that can happen while you prescribe an exercise regimen to a kidney disease patient? There are personal barriers and then there are personal enablers. So, personal barriers for a CKD patient are they're usually fatigued, or if they exercise, they cannot recover quickly to active state. They have a fear, they have mobility issues, then there is a lack of drive to go for exercising, and then there's frustration and disappointment and helplessness. So in order to overcome these barriers, it is the doctors, their family and friends who should enable them through various activities. One such example of enabling a kidney disease patient to exercise is tomorrow's event, where we are involving kidney disease patients who are participating in 10 kilometer, 5 kilometer and 2 kilometer cycle races. So this is a fantastic initiative through which kidney disease patients feel inclusive, which is a very common term that is being used these days. So including them in normal day-to-day activities is also enabling them for a good quality of life. Lastly, when should we prescribe exercises for acute kidney injury patients following discharge? We need to remember that acute kidney injury patients are the patients which will progress to chronic kidney disease. And there's a very narrow window to prevent that. So AKI, after AKI, there is a period between more than 7 days but less than 90 days, which is called acute kidney disease, in which exercise can prevent AKI patients to go into CKD. So, but while prescribing exercises to them, we need to keep in mind the patient's age, the multiple morbidities they may have, the type of exercise which we need to prescribe. For example, somebody who has recovered and who was intubated and has got extubated with an AKI cannot be asked to run 5 kilometers a day immediately post discharge. So there should be a gradual increase in exercise regimens. And of course, we need to keep in mind the baseline cardiac function. And when should exercise be prescribed for AKI patients is immediately after discharge. Of course, with what I just mentioned, they should gradually and slowly, keeping in mind the physiological vital parameters, keep on increasing their exercise schedules. Last word about azelnidipine, that is Zeblong 8 mg. It's a calcium channel blocker, and we very commonly used in CKD patients with resistant hypertension. It is a dihydropyridine type of calcium channel blocker, and it is a third generation. It is available in 8 mg and 16 mg. The maximum dose that is being tried on is 32 mg, but the safest zone is 16 milligrams. It can be given twice daily, and it is an excellent drug to reduce hypertension. So, thank you all, and I wish you and welcome you for World Kidney Day.
Thank you, Purva Madam, for such a masterly presentation on a topic which is really not only difficult but to comprehend, but also very difficult to practice. Now, can I ask you one question, Madam? You said AKI patient 7 days to 30 days is the time, 90 days, sorry, 3 mahine paranta. So 7 days to 90 for 3 months, he should not exercise. He should exercise. Okay, please clarify on this.
So what I mean by initiating exercise for patients is, for AKI patients is, for example, if we have an AKI which is improving and which has been planned for discharge. For instance, say the creatinine was 3 on admission or 5 on admission, whatever treatment was received for the patient, and the patient's AKI recovers. So AKI recovers meaning the renal function comes down to 0.8 or 1 creatinine, or he's passing around 2 to 3 liters of urine per day. In this scenario, what happens is, if when they go home, their diet changes, their hydration status changes, their attitude towards the disease changes. So they are again at risk of chronic kidney injury, which can continuously, there are multiple hits to the kidneys, which can occur over a period of 90 days. And if a patient, if you've discharged them at creatinine of 1 or 0.8 or 0.9, 1.22, that patient after 3 months may come back with the same creatinine, or their creatinine may be elevated. So one of the prescription that helps AKI patients is exercise. Now, what form of exercise, the next speaker will let you know about. But kidney disease patients not to exercise is not the caveat anymore. You should promote exercise in them, both AKI as well as CKD. But of course, AKI who are recovering.
Thank you, Purva Madam. Now our next speaker is Mr. Gaurav, who is a strength and conditioning coach, and he's going to talk on effect of load variation on jump height. Now, friends, I'll tell you, these are very difficult topics. There's a lot of work going on in sports medicine on these topics, and I'm really glad that there's somebody who speaks on this.
Thank you so much, Doctor, for introducing me. And thank you, Dr. Bavikar, for actually giving me the opportunity to speak about a very niche profession, which is called strength and conditioning. Till now, I feel, a lot of times we feel that we know that we have to exercise, but we don't know where to go and how much to exercise. So that is why strength and conditioning coaches come into the picture, wherein we can guide you how much to exercise, when to exercise, and what is the right dosage for exercise. So here I am. My name is Gaurav Nijon. I'm the founder of Nijon Training Systems. Basically, Nijon Training Systems is a system that is evidence based, and we can also now implement these systems not only in a athletic setting but also in a healthcare setting. So today, more than talking about the science of strength and conditioning or sports science, what I really wanted to take you through is introduce my profession, and then we can take it forward from there. Great. I think for the lot of time, one perception that comes to our mind when we think about strength and conditioning, or we think about strength training, we always have this picture of a bodybuilder, right? So whenever we go to a gym, the first thing we think that the guy who's got magnificent muscles is the right person, or is the go-to person, right, who can make us exercise. But here we are, you know. Uh, so who exactly is a strength and conditioning coach? So we are basically exercise science professional. We go through a strenuous 3 years course from bachelor's of sports science to then masters in sports science. And usually at this point in time in our country, what we've done is we usually work with most of the athletes, but we are also now trying to extend our scope of practice from athletes to now actually working with healthcare or general population as well. Right? So how do we actually improve performance, right, for athletes or probably for general population, right? So we basically understand a few parameters. One of them is, just by checking blood, we do blood lactate analysis, we do biomechanical analysis. So we basically are going to see what exactly and how much is the joint, how much is the range of motion a joint is going through, right? We also do VO2 max testing, wherein we can now know what is the highest amount of oxygen consumption that you need to play a particular sport. Thereafter, I think, how do we design a program? Often, when we talk about strength and conditioning or we talk about exercise, we go to the gym, we basically have no clue where to start. Just like how in every sport we have we do a needs analysis. So that needs analysis basically involve, first of all, we check that if you're a tennis player, this is a needs analysis of a tennis player. So we basically know now that a tennis point doesn't last for more than 10 seconds, right? Distances covered in tennis are 2.3 kilometer for male and 1.6 kilometer for a female athlete during the entire match. Aerobic capacity of minimum of 50 ml per kg per oxygen is required if you want to play at the highest level. And a typical three-setter, if we eventually don't see a lot of three-setters over on the television, we usually see the five-setters. But while going through the development process, an athlete plays for around hour and a half, out of which the playing time is just 18% of it, which is maximum 30 minutes, right? Now, coming back to how can we relate this to our general population, to all of us, right? It is very, very important that I think a lot of earlier speakers have covered the science of it, right? But why it is important that we need to analyze what is our needs personally. So our needs as a general population is that we have to be fit. Now there are a lot of different definitions of being fit. One of the definition earlier actually he gave, Dr. Patne said that it is extremely important that you can do your daily functions without any pain. Just imagine the fact that you have to actually climb 10 steps and you're huffing and puffing, right? So we definitely know that the direction now we are going towards there is some kind of an issue and we need to now solve that problem. Before we can actually get into, how can we improve performance, these are some of the basic mechanical concepts that we study or basically we inculcate in our daily practice. If you see, force is nothing but mass into acceleration, and power, I know that's a little bit, high level stuff, but power is nothing but the rate of doing work, of how fast we can do a certain, work as soon as possible. So that maybe, probably if you want to just get off the chair, you're able to get off the chair very easily. But if you see over the point of time when we, hit the age of 45 or 50, it is very difficult to perform just an activity which is as simple as getting off the chair or maybe squatting 5 to 10 times as fast as possible, right? So why is it that we are not, why do you think that, we can't do that, right? So because we are not training for one quality, which is very, very important, which is called power, right? So we usually go to the gym, we lift heavy weights, but we never train for power, right? So again, there is a concept in sports science which is called the force velocity curve. So we basically take the athletes to the entire force and velocity spectrum, if you can see in the graph. And then we segregate the athlete into, probably if the athlete is in the higher side of y-axis, if you can see, that athlete is more force dominant. And if the athlete is, on the lower side of the x-axis, the athlete can produce more velocity but lesser force. So these two different athletes, or probably these two different individuals, even for general population, if we can take them through the entire force velocity testing, we can exactly know that how much of weight do we have to prescribe, so that's the load that you really have to train in. Instead of just going to the gym and randomly lifting maybe 10 kilo, 12 kilo or 15 kilo, we've got no idea in which direction we are moving towards in. This is one of the study that we did, when I was in the university, checking the effective load variation of jump height in adult male tennis players. So what we asked them, we recruited different individuals and we asked them to do jumps on a force plate with basically just body weight and then a 20 kilo barbell, then a 30 kilo barbell, and of course the last one was a little on the heavier side, if you can see down, with a 40 kilo barbell. And of course we noticed that as and when the load increased, right, it's pretty obvious that the jump height would reduce. But why are we even checking this? Because probably there are two individuals, just like, general population, or, just like me and you, who would actually jump the same, but the rate at which we are producing forces might be totally different, right? So if you see, right over here, we've got an equipment which is called the force plate. We can now ask the athlete to jump on the force plate, or rather, we can ask any of you guys to jump on the force plate. Actually, we've got the equipment, we are making it available tomorrow. And then we can exactly know the amount of force that you have produced, how much time you took to produce peak force, and how much was the rate of force development. And now, accordingly, instead of guesswork, we've got some data, and now we know that there are certain parameters that we have to train, so that for the entire longevity of our health over the period of time. All right. So again, as I said earlier, that strength diminishes at 10% at the age of 50. But if you see, after the age of 40, power diminishes by 51%. So guys, have you ever imagined, when probably you were 30, you were able to sprint, but today if you are 50, 55 or 60, you are unable to jump, sprint, or probably even cycle fast, right? Like the way you used to do when you were young. That's because we've never trained for power, right? So what can we do in everyday life, right, to make sure that we're training for power? We can basically, just get off the chair probably a little faster, we can squat a little faster, we can take lighter weights, work a little bit on our jumping activity, and challenge our footwork, right? Basically just do a lot of coordination work, because eventually we see a lot of balance issues happening in elderly people. So if we do all of these stuffs, probably functionally we will be there, and we might not have any sort of injury, and we'll be able to do our functional everyday life work smoothly. I think This is one of the videos. This is my mother who's been training with me for almost 6 months now. And if you see, I'm doing nothing but just taking her through, as Dr. Patni said, through the entire spectrum of progressive overload, right? So first he started with basic weights, gradually moving forward. If you can see in the video, we are also doing, with a little heavier weight. And this is power. Basically, I am just taking her through how fast can you actually move a lighter object, so that we are now working on power. If you see, these are nothing, basic things that you can do so that you can work on power, right? And not, so the ability of, to produce force, of course, you've got it, but you also have to train for power so that now you can do, a specific thing as fast as possible. Going forward in the future, our aim is to, if we can, bridge the gap between sports and patient care. That how can we open a facility wherein we can do, multiple, uh, procedures, interventional procedures. But at the same time, we should also include, sports as an intervention wherein they are not, after probably a surgery, after a few weeks with the guidance of healthcare professionals, we can help them to play a specific sport, take them through the entire spectrum of strength and conditioning, evidence-based practice, and we can, eventually, increase their quality of life. Right? Thank you so much, guys. Thank you.
Thank you, Gaurav sir, for such a informative talk. And I just wish that our city of Sambhajinagar also has this facility in near future. And very knowledgeable people in this field who would guide us. We all know some things in bits and bits, but this is a scientific way of knowing things. Mind you, friends, interventional clinical physiology is a very, very important branch, and a lot of work is being done. A lot of work is being done in India. I would just like to know from Gaurav sir, do we assess, means do you have any certain parameters to assess with a person below 50, above 50, and our exercise protocols post-COVID?
Sure. I think there we don't yet have enough research in terms of exercise or strength and conditioning post-COVID. That is where the healthcare practitioner comes into the play. But in terms of assessment for people over 50, one of the major assessment that we do is the talk test. If probably we just ask you to walk at different speeds. So let's say you start from 6 kilometers per hour on a treadmill, you go to 8 and you go to 10. If you can't continue that activity for more than 5 minutes without having a normal talk, then that's the time we know that we need to stop and eventually increase the threshold. That, I hope that answers my question. Sure.
Thank you, Gaurav sir. I invite our next star speaker, Dr. Suhas Bavikar, who is probably the first nephrologist from our city, and he's been practicing for past 32 years, if I'm not wrong. And he has pioneered so many things in Aurangabad. Aurangabad was a small place some 30 years back, but in those days I still remember him to be in great demand for putting in central catheters. That was also a very, very novelty in this city because it was a small place. So he has pioneered many things. Now he's going to talk on the role of immune system function tests in kidney protection.
Thank you, Patni sir. At the outset, I would like to thank each one of you for sparing this Saturday evening with us. I am talking to you on immune system and kidney diseases. I'll give you some analogies and beg your excuse for in case I hurt anybody. The two concepts I would like you to take home are one from cricketing analogy and the other from political system. From cricketing analogy, I would like you to remember three players. One is Sachin Tendulkar, second is Chris Gale, and third is Kieron Pollard. So the point I want to drive home is all clinicians who are dealing with kidney diseases should learn to understand the artistic batsmanship of Sachin Tendulkar and not learn hard-hitting power batting of Chris Gale. The simile I am giving you is to drive home that each kidney disease has its own treatment. Diabetes has its treatment, hypertension has its treatment. But if you study a patient's immune system and then use that for the patient's benefit, just like Sachin Tendulkar, you must be remembering the famous shot of Sachin Tendulkar over slips to Shoaib Akhtar in the World Cup final, where he understood the speed and direction of the ball and guided the ball with uppercut to over the head of the slips for 6 runs. So not hitting the ball and guiding the ball is the artistic approach of a batsman. So similarly, all doctors should use patient's immune system to guide the treatment and understanding immune age of the person, young system or old system, whether person is immune competent, immunosuppressed, immune activated, immune paralyzed, immune deficient. All these situations, statuses, will have different patients will have different statuses. Just like each ball is different and the batsman has to understand the ball before he hits. So understanding immune system by doctors who are treating kidney patients is very essential to become skilled managers. And then second point I would like to take you home is the relationship between immune system and kidney disease. The immune system and renal system are like two political parties. Congress, BJP, Shiv Sena, just political parties. So when they are in power, they are very friendly to each other. Just like immune system and kidney disease, when you are healthy, they are helping each other. But when they are in opposition, they are fighting, then they will make each other's life miserable. So in kidney diseases, I would like you to classify them into 3 groups. One is the disease with disordered immune regulation causing kidney disease. So these are IgG disease, good pasture syndrome, anti-GBM antibody, IgA glomerulopathy, antibody IgA is responsible for that, complementary disorders, immune cells causing crescentic GN. These disorders are disordered immune regulation system causing kidney disease. Then the second group is CKD is happening because of other diseases like diabetes, hypertension, obesity. But immune system is adding to the speed with which these diseases progress. So the inflammation added by immune system activation will kill the kidney faster and person will reach end stage faster. And the third group is CKD and immune system are friendly to each other. They are not affecting each other. So if you understand before starting treatment with kidney disease, whether the immune system and kidney are friends or enemies of each other, then you will do much better. That can be done by doing a biopsy or biomarkers or urine test, blood test. There are many things which we can do. I'm not going to speak on that. So we will just, I'll just give you some words from politics for each of these slides. Overview of innate immune system. Just imagine a political party. It has got two wings. One is the party per se, and the other is the leaders in power. So innate immune system and adaptive immune system are the two parts of an immune system. Innate immune system is like, say, BJP, just giving an example. So BJP as a party, there are 14 players in innate immune system, there are 14 cells. So similarly, there are many members of BJP party. And adaptive immune system is those who are in power. So chief minister or prime minister or ministers, cabinet ministers. So there are 7 players in adaptive immune system: T cell, B cell, T helper, T killer, and plasma cells and B cells. So these cells and of party players and the people in power, they are playing a game called Taki. You may remember a song, Taki O Taki, Taki Re Taki Re. That was in Himmatwala. So Taki is a word to remember for T is tolerance, A is apoptosis, K is killing, and I is inflammation. So all these players in both the party and in power, they are playing this game of killing and inflaming, means killing the opponents or the cells which are foreign to you. And sometimes if the disease happens, they will kill the cells also. So this is the picture of the players in the immune system and in the political party like. These are the numbers of the cells which are there in your blood. So similarly, we have political posts, we can classify them as mediators. So mediator, political activator, then the leader, and then the सतरंजी उठाने वाला, ऐसे काफ़ी लोग रहते हैं political party में. So we will focus on 2 people. One is a mediator, like say Sanjay Rauts or Pramod Mahajans or Jairam Rameshes of today's era. These are the key persons kind of bridging the innate immune system and adaptive immune system, and then deciding whether the adaptive immune system kills or inflames or tolerates. So that is how the political parties work. Antigen presenting cells, T helper cells or dendritic cells, these are the intelligence bureau of each party. They will find out which party worker is working against the party, which party worker is genuinely working for the party. Likewise, they will feed the information to the proper persons and then elicit a response of the leader or the boss who can generate inflammation or kill the person who is not desired. So phagocytosis is the word used in immune system, immunology, where you eat a small, bigger party will eat a smaller party. So phagocytosis is the word, and there are different receptors on these phagocytes. So there are some undergraduate killers and there are some postgraduate killers in immune system. Similarly, in political system, there are killing means not giving a ticket to a political activist is killing his political life. So similarly, killing self cells or killing the foreign cells is mediated through receptors. Receptors are the informers of the political system. Opsonins are another flags or party symbols or loyalties of the person or the player. So these are the terms in immunology, toll-like receptors and PAMs and DAMs. We are not going to go into details of these. Toll-like receptors, PAMs, pattern recognizing receptors. There are different ligands, toll-like receptor signaling, then rig-like receptors. These are all methods of creating communication between different party workers. So inflammation in political language is, Shiv Sena language is Rada. So Rada means fight between the two parties. If that happens in the kidney, then kidney fails or CKD happens. So inflammation So this is the intelligence bureau or of the immune system, and this is the key cell or key person in political life. Say Amit Shah of today's era, dendritic cell. So I'll stop here and would like to thank you again, all of you, for sparing your precious evening with us. Thank you.
Thank you, sir, for making such a difficult topic so lucid. I have a small question for you, sir. Can you tell us is there any way to know that whether the immune system is working in unison with the kidneys or it's going against the kidneys? Is there any marker for it?
See, if someone's creatinine is normal, urine is normal, his GFR is 100 plus, then the kidney is said to be healthy, then immune system and kidneys are working in same party. So they are helping each other and not causing any disease, not allowing any factor to injure and fail the kidney disease. It will not allow kidney disease to develop if your immune system is working with your kidney.